So as just mentioned, today we talk about how can we come from training principles to individualizing training prescription. And as you can see from the lecturers, basically, this is a session that was mainly inspired also with the discussion with Florian Hanakam, who's also, of course, a lecturer at the Training Science Department. We created this course, this framework earlier on. So this is why he's also mentioned here. Without him, this entire process and the case examples wouldn't exist in the current manner. So it's also relevant that even if he's not present today, he was a main driver of this session as well. What we will talk about is, first of all, the one idea of how we can think about individualization, the individualization pyramid, and then we make an applied case example. The first part should be really short, and then we go to long part of group work, basically. And this is the pyramid I'm talking about. So here you can see different levels of individualization and the timeliness of training prescription. So if we think of the training process, when we then try to apply this to an individual, we first always start with general ideas of the setting and general training principles. So we first have a rough idea of what are we actually working with, which sport, which client, and what are general training principles that apply in this setting before we think about the individual. So for example, we can think of different competitive load profiling that we do, like what are the actual internal and external loads, for example, what are the competition and game demands, how are competitions scheduled in a specific competitive sport, and what is the performance structure, how many offensive, defensive actions are there if we talk about competitive sports, or if we think about training load profiles and training intervention studies, if we think about training and exercise more broadly. So even if we think about a health setting, patient-related settings, for example, maybe the competition analysis is not relevant, but we also think about what are benefits of different training interventions and what are general training principles that we derive from these basic studies, basically. So if we know what the setting is, we can already start making the training a little bit more specific than if we just have the average person. In the second step, individual prioritization, we then again, if we have a competitive analysis, can talk about competition analysis at a specific week. So what is the competition in the upcoming, or what is the opponent in the upcoming competition? Or I analyze my competition results in the last competition to see what do I have to change to improve in the next setting. I can do individual prioritization by regular performance tests. Am I a good or bad performer? What are my strengths and weaknesses? In this third step, we then think about individualizing the training load management, also by using performance test indicators. And we can also look at individual and sport-specific characteristics to further individualize the training process. And then if we applied all these different steps, then we can think about the current adjustment by recovery and load monitoring. Before this, all the individualization happens on the more broad and general perspectives. And as you can see from the bottom to the top, there are lots of steps before monitoring actually gets relevant. But we're still talking about individualization, and we're still talking about adjusting more and more the currentness of the training process. Very theoretical in the beginning as usually, but I will give some case examples that you have a better understanding of what I mean. So first of all, if we think about general training principles, for example, we first of all always understand or try to understand the basic setting. So if I have a specific sport, what is the specific demands of the sport? How can I assess performance, training loads, etc.? And based on this understanding of what is my actually setting of action, I already have the first step towards a more individualized perspective. Of course, I would train a weightlifter completely different to a long distance Ironman triathlete compared to a health and recreational athlete. This is, I think, very, very clear. And even if we have ticked these boxes, we have further individualization right away at the beginning, just by making clear what is the actual training setting. And very briefly, I want to go through a couple of training principles that are quite common, at least in the German literature. I'm not sure how well they are established or formalized in the international literature. So I will quickly go through these, and then you can give some examples of what you think of the different training principles. So first of all, for example, sport-specific training content and load, what I just mentioned. Different sports have different loads and different requirements. Another principle is that we need to individualize load prescription, that we need to individualize the load and recovery perspective. Point 3, we need to think about systematic performance control and training prescription. So also thinking about testing and using the testing to individualize training. Training planning by periodization is also a very important aspect, although the scientific evidence is a little bit more difficult because we're talking about long-term perspectives. And it's always difficult to make well-controlled studies in the long-term run. Optimal relation between stress and recovery, partly related to the individualized load prescription. We need to divide between age and gender-specific loads. We also should think about increasing specialization in the development. So when we think about childs and adolescents, we always think about very broad development of something like general motor skills, and then increase further the specialization throughout the training process in the long run. Also, variability in sense of changing and varying and increasing training loads is a very important aspect. And we also talked about different ways how we can quantify variability in training. The correctness of load sequences. So there is quite a good understanding of different sequences that we should apply. So if, for example, should we start with a speed session before an endurance session, before a strength session, or should we put the things other way around if we have specific goals in mind? So sometimes there is something like a correct or at least more appropriate sequence within a training session or within a training cycle. And we, of course, have to think about training effective stimuli. So is it enough if I clean the kitchen to get fitter? Depending on the fitness level, this might be insufficient training stimulus, but again, if I'm very fit, training effective stimuli may look differently, and a training session that is effective for one athlete doesn't have to be effective for another. And of course, another general training principle is that we can use technology support to further implement this into the training process and to further individualize. And now I would like to ask you to give some clear examples of what do you think, how could you apply these different training principles in practice? So please just pick a couple of these and give us some examples of what do you understand with the different training principles. If we think about the second aspect, individual prioritization, and we also mentioned some things there, we could do performance testing. For example, build individual profiles and see player A has a different performance profile than player B. So we may individualize or set different priorities between different athletes. And we can also track these changes over time to see do the priorities change over time, and am I actually making some progress on what I aimed to develop. And also this can be different philosophies. If I want to strengthen the weaknesses, or if I want to further develop the strength, or both, depending on the time I have. And yes, this is, I think, another example of how individual prioritization could be from a complex, complete performance testing basis. And this is, again, setting different priorities. And another further step after general training principles to further individualize training. Third aspect, individualized load management, and this goes hand in hand with the things that we talked about before and that you learn about in the other sessions as well, I believe. For example, based on performance testing, and as was also mentioned, if I do incremental treadmill test, I can evaluate or I can assess the different thresholds and build training zones based on individual thresholds. And then I have an individualized load management, and everyone can work if they want to increase aerobic capacity high volumes at low intensity below first threshold, for example. So I can use performance testing to individualize load management. And then if all these boxes are ticked, then I can think, and then I should think about monitoring of recovery and loads. And for example, I can try to collect regular data to understand the training process in more detail. And then depending on the plan that I have in mind, see, does anything happen that is not expected? Or do I reach my goals? If not, I can try to change the training plan as I go on a weekly basis, on a daily basis, depending on how often I want to change the training plan or how often I can change the training plan, and if I'm meeting or not meeting my goals. That's the basic idea. And this is only the last step of individualization. But then, of course, I can individualize at best if all the other boxes are ticked. So let's go to the case example today. And we will make an, I think, relatively realistic case example that you are working as a sports scientist in a facility that provides sport medical and training scientific support. You do performance testing for health, recreational, and performance-oriented clients. So this is basically my second workplace, also the workplace of other students from the year before you that also tried to work there. So a regular regular work environment for sports scientists. Afterwards, you do testing and you consult different kind of athletes to improve their training principles. And in this setting, as an applied sports scientist, you have a client. This client is a male, age of 48 years old. He's an executive management. He's at an executive or management position. He does a lot of business trips. He's married, dad of 2 children. He used to do a lot of sports in the past and now has the goal to run a 10K run below 50 minutes. Or he used to run 10K below 50 minutes in 2011. That's a couple of years for now. He hasn't been doing any sports for 5 years. He's presumably overweight based on his regular appearance. It's not always very clear to tell from the clothes people are wearing, but you may expect that he's a little bit overweight. And he's interested in a general training plan and some personal training. That's the basic idea, the person that you meet in your facility. And based on the first consultation, based on the first interview with this person, he says he wants, regarding his health, he wants to lose body weight, and he knows that he has quite, or he expects that he has quite poor cholesterol values and also wants to increase or decrease them. And as a performance goal, he wants to finish a 10K run with a very good friend in 6 months time. And he wants at least to run below 70 minutes, ideally below 1 hour. So this is basically the setting. You work after, or at the moment, or after you finished your master's as a sports scientist, you have this client in front of you, and you should try to go through the entire training or individualization pyramid, check the different boxes to think about what can you do with this specific person to meet his individual training goals. So at the health perspective, to try to decrease his body weight and cholesterol levels, and to make him able to finish the 10K run in ideally below 1 hour in 6 months time. So the basic idea is that you now think about different steps. You go in different groups and talk about, for the first step, sport-specific profiling and hierarchization, what could be the things that you need to consider with this specific person in respect to training and competition analysis for a take-10 run, and in respect to general training principles that do apply to this specific person. And what would you draw for, what conclusions would you draw for training planning based on this first step of individualization? To make it a little bit more clear before you start, so the thing is that we now split up into groups, and you can think of, and you can make just some basic decisions about what you expect from this person. So you can say, for example, okay, I want to use this I expect that a 10K run is typically contributed of this and that amount of energy distribution. Therefore, I want to apply this specific kind of training principles. I know that general health-related endurance studies identified that this kind of training periodization is very beneficial, and therefore I want to conclude, therefore I have some general ideas of the training planning process in mind. So this is what we do right now, and if you open the working file and we go to the first, on slide 5, to the first level of individualization, here are some things that I took some notes on. So for example, I thought about what are the typical competition load profiles in a 10K run, what is the typical performance structure, and I will give my example later on. I thought about what could be a typical training load profile and what the general training intervention studies tell us about endurance training for this setting, what are general training principles that apply in this case, and how could a very, very rough training planning look like from this first step of individualization. All right, so we will split up in several groups. I think, let me see how many people we are, how many people we still are. Yes, so let's make it groups of 5 to 6 persons, and each of you go together and take some notes on what do you want to do with this person. And later on, you can also say, okay, we did some testing and this person has weakness there and a strength there. So you can also make up an example, and you don't, like, you can think of what are the results of a theoretical testing that you would apply to this person. All right. So what we thought about the first step of individualization, we also know that a 10K run is mostly contributed of aerobic energy and only partly about anaerobic energy contribution, at least if we think about a 60-minute performance, which is also roughly around or below the second threshold, mandatory or lactate-based tested. Polarized training seems to be quite beneficial also for recreational athletes to increase performance, and also based on experience, it's well tolerated orthopedically. So if we think about potentially overweight person, this also might be a good strategy to polarize training and do a lot of low intensity. First of all, as a general training principle, we first try to increase the low intensity volume by frequency, session volume and intensity, then increasing intervals regarding more specialization. So we would start, for example, with short and high intensity intervals and go further specialize to the actual competition load with longer and less, relatively slower intervals based on threshold intensity. And for example, we would apply a general 3-to-1 periodization with 3 weeks of increasing loading, 1 week of relief, and for example, plan a 2-week tapering period in the beginning. Regarding the training planning, for example, we would also consider at the end of the 4th month, a 5K run as a preparation competition, for example, and also to get some brief running experience, to have a little bit better performance at the 10K run, and also use this as a performance test, which we talk about in the next session. And as also mentioned, we would go with the 80-20 rule, so using the polarized training, so roughly 80% slow intensity, 5 threshold, and 15 high intensity. That's the basic idea, how we would start, for example, with this client. So let's move to the second level of individualization, and you can repeat some of the things that you already mentioned, which are, we do some assessment. What and why would you choose different assessments regarding health, regarding performance, and regarding strengths and weaknesses? And you can take some notes on examples that you would give, and also you can think about specific results. And then based on these results that you can theorize, what would the conclusions regarding the training planning look like? All right. So really quickly, what we thought about individual prioritization. So for example, in respect to health assessment, we would do a resting and stress ECG. We perform spiroechometry, blood count, and identify that he actually has high cholesterol. Do some anthropometry testing, high BMI, high body fats, muscle mass is okay. So still some memories left from his active career, basically. And we identified that he has some orthopedic based on the orthopedic assessment, basically, he mentioned that he had a meniscus surgery. Again, fictitious case example. Performance testing, there could be, for example, a weakness at the first ventilatory threshold, second threshold, and maximum performance would be okay. And therefore, he's probably limited tolerating high training volumes. So therefore, because of the overweight in the meniscus surgery, and therefore we would consider this in the planning. What we would do is then, for example, for the first 3 months, and this was also mentioned in the other groups, do some more extensive endurance sessions only on a bike to reduce impacts from running until he increased his stress tolerance, basically, and also increase a little bit of weight training. And in the first 3 months, focus on very high volume of low intensity and no threshold training, and change this over time. Also regarding nutrition, he might increase omega-3 fatty acids based on this profile. In the next step, we would look at the individual load management, and I would suggest that we do this as a group work together. So individualizing the load management when looking at performance testing. We also thought about using a 5-zone concept. This is where we had experience on, and this is what is well established. Using threshold-based intensities and also considering the injury history, basically. This would result in a training planning that the intensity in endurance sessions, as you mentioned also, would be focused on heart rate in the extensive runs, running speed or running time in the interval training sessions, and RPE for threshold or competition pace. So for example, do you already feel prepared to run at the achieved race pace, or how does the expected race pace feel at the moment? And for example, we could use the anthropometric, the weight assessments, to also change training. So for example, we could increase the volume of extensive runs if the client drops 5 kilos of body weight. For example, we could also make thresholds and guidelines in our training planning if we hit some key indicators, for example. Follow-up testing, we would evaluate anthropometry. I'm not sure how it is pronounced correctly, each month. For example, also regarding cholesterol, we would recommend full blood count each 2 months, and performance testing after in the half of the training period of the 3 months. Then we would also use the 5K run to adjust the intensities in the last month, and use use this to adjust the periodization if necessary. Also, and as a matter of time, and because I think this is the least important thing, and we talked about this in quite extensive detail in the last session, some ideas about current adjustments regarding monitoring. So what and why could we do there? Regarding recovery and load monitoring, it is very useful in runners or endurance athletes recreationally to look at heart rate monitors, including GPS, for example, and we can then derive heart rate, duration, volume, speed in every training session. And also for the non-running sessions, we could very easily apply session RPE, as was also mentioned from you guys, to evaluate if our idea of progressive loading, both on the volume and the load, do play out, and what is actually the training distribution per week. This was also a key indicator that we meant to plan. So we could also evaluate this regularly to see, do we have to change something? And we can evaluate the orthopedic issues. Is everything working out fine? Or does he get knee injuries? Then we need to change something in the training planning, for example. How could we do that? For example, we could see based on the body weight if the overall energy expenditure in respect or compared to the energy intake is appropriate based on weekly body weight assessments. We could change running or bike volumes based on the orthopedic issues, and we can adjust weekly training plans based on weekly load analysis, basically to see if our plans actually work out. And the interval training prescription could also be used as an indicator of, do we actually move in the right direction? Do the specific speeds, the running speeds, the paces already feel towards the direction of my actual running goals? So if I want to run the 10K in a specific time, specific intervals should be doable and should feel in a certain way, at least shortly before the competition. Otherwise, it will be very, very difficult to achieve those goals. So these were some examples on a specific case. I think you had very, very good thought processes, and this is what I wanted to introduce today, of what are the different areas that we need to think about if we think about individualization. And it's also, I think, very important that we start with the basic ideas first. So if we know we talk about endurance and 10K, we definitely schedule and plan differently than if we think about maximizing muscle growth or increasing strength and so on and so far. These are always the first steps. Then we go further and further into the individualization of training, and monitoring is only the last aspect to help adjust slightly. But if we are already moving into the wrong direction, it will not help. So first we have to make the first direction and the general route correctly, to then apply monitoring appropriately, to adjust the small details afterwards, and also to get the communication between the client and us as the practitioner to get that appropriately.